Royal Oak has always been a special place to me because I remember a few years ago I came down during Christmas and I remember seeing all the lights, people out in the streets, the vibes were high. And I thought to myself, this is where I want to live.
Welcome back to the ROCC Pod, produced for the Royal Oak, Michigan Chamber of Commerce. I am John Gay from Jag Podcast Productions. My co-host Lisa Bibby from Century 21 Northland not able to join us today, but I am thrilled to welcome in Dr. Tasneem Karassi of Wellness Family Dentistry. Welcome to the podcast.
Thank you so much, John. I'm happy to be here.
All right, before we talk teeth, I love this. You told me offline that you're a ceramics instructor at Creative Arts Studio here in Royal Oak. Is there a connection between ceramics and dentistry, or is it just a fun hobby that you kind of have on the side?
To be honest, I've found that a lot of dentists love working with their hands, so they almost always have some sort of hobby that's hand skill related. It's funny because you'd think I'd be tired of working with my hands, but I honestly love it. It's a nice way to get your hands dirty. I can't be on my phone. There are no pottery emergencies. So it's really nice. It's a good way to unwind. I've been doing that for about 10 years. So
wow.
I'm so lucky to have a studio so close to the office. So we're only about a mile away from the ceramics studio. So very lucky to be doing that. But yeah, great hobby to have.
I thought there might be a connection there, but it's funny what you said about, you'd think you would not want to use your hands because you use your hands all day. For me, I produce podcasts all day. So when I'm in the car, I just listen to music because I'm tired of the voices in my head, so to speak.
I'm not going to lie. I'm pretty silent while I'm doing pottery as well.
Oh, that's fair. That's fair. So how did you come to start the practice and why here in Royal Oak? Give me a little bit of background on the business.
So I have been a resident in Royal Oak for a few years now. I was working at a couple different practices in Shelby Township, in Flint area, so I was commuting quite a bit. I'd known I always wanted to be a business owner. I'd always wanted to own my own practice and really cultivate something that was unique. That was my vision. That was my kind of baby. And it was really one of those things that, most dentists purchase another dentist's practice as people retire, and startups aren't as common, but I was so fortunate. My best friend actually is a business owner. She owns a couple of fitness studios in Royal Oak as well. Shout out Sculpt Studios.
Okay.
And she was talking to me one day and she said, what do you think about a startup? You have all these visions, all these ideas. You really can hone those in when it's something from scratch. And we had this beautiful space that opened up for a practice in Royal Oak in the same floor as ZMC Pharmacy. And it was one of those things where the stars just aligned. The ball was rolling pretty quick. And before you knew it, this vision came to life. So Royal Oak has always been a special place to me because I remember a few years ago, I came down during Christmas and I remember seeing all the lights, people out in the streets, the vibes were high. And I thought to myself, this is where I want to live. And so I bought a house in the area and then slowly this became my home. And now having the practice here, it's really been so fruitful.
Where are you from originally?
I'm actually originally from Alabama.
Oh, wow.
Yeah, so I was born and raised in the South.
And we're recording this on Friday afternoon, January 16th. We were just talking about the crazy snow as the snowblower is outside my window right now. That had to be an adjustment when you came up here.
It was. I actually went to school in Indiana, so go Hoosiers. Okay. This is our year. But I've been in the Midwest for about 10 years, so I've slowly inched my way north. I always joke that my next move will just be Canada because I just keep moving more and more north. But it's an adjustment for sure. I've realized the trick is to have all the gadgets. Get the boots, get the jacket, get the 4-wheel drive, and you'll be fine.
Exactly. This is going to publish after the national championship game, so let's hope that Go Hoosiers went well for you.
I hope so. Thank you. I hope so.
All right, I want to ask you about dental anxiety. A lot of people in my family have major anxiety going to the dentist. I know that's a specialty of yours. How do you help patients deal with dental anxiety?
One of the most important pieces with dental anxiety is trust. A lot of times the reason patients are anxious when they come to the dental office is because it's such a vulnerable space.
Yeah.
You don't know anything. You're trusting a complete stranger, and you kind of just have to take the dentist's word for it. So in the past, it was one of those where a lot of people saw the same dentist from when they were a kid to when they grew up. You saw the same dentist as your parents. So the trust was embedded through community and through, oh yeah, this is who my mom saw, so I'm sure it'll be fine. Nowadays, you have more people moving. People are moving dentists based off of insurance benefits, off of location, maybe their spouse. So the trust is a little harder to build. So something that we try to do here is really take our time. That's one thing that I've realized. If we take our time on the front end and build that trust through communicating properly, explaining to patients using pictures, using digital scans, using an x-ray system that is easy to read. Believe it or not, the system that we use is all color-coded when you look at the tooth. So even though it's an x-ray, you'll still be able to see, oh, this is where my nerve is. This is where the cavity that the doctor is recommending we fill is. And really going through a thorough medical history to understand the patient's anxiety. Is the anxiety something that you have intrinsically where you are an anxious person and there's something that we need to be doing as far as medication or management? Or is this something where I kind of have always gotten nervous at the dentist? Maybe you had a bad experience as a child and we can slowly get over that hump, because the reality is dental care is a necessity. Yeah. Everybody needs to get into the dentist. And if we're not going in because of dental anxiety, then we're really kind of doing ourselves a disservice. So the biggest thing that we try to do is we take our time. You're not going to be rushed in and out like you are at a lot of different places.
Sure.
And not just in dentistry, even in medicine nowadays, that's kind of become the trend where you're like, oh my gosh, I completely forgot to ask the dentist this. And now it's another 6 months before I'm able to even see this person. So we try to really take our time, thorough medical history, thorough diagnosis, explaining everything. I had a patient just the other day who we had seen her. She was coming in for her treatment and she called the office and she said, Dr. Karassi, I want you to go over the treatment with me one more time. I said, absolutely. You can come in. Well, let's go over this treatment. This is a big treatment. I don't want you to feel like there's any information you don't know or understand. And that's what we did for her. And after that, she felt a lot more comfortable and she was ready to proceed with the treatment.
What you're describing is really hitting home for me, because I have a family member who has real dental anxiety and she's been through several dentists. And what worked for her was someone who would explain what's going on, take that mystery out of it, get to that point where this is what's going to happen. This is exactly what you can expect, et cetera. And I think that's absolutely huge.
Yeah. Another thing that we do, these are a little bit more anecdotal, but we try to keep the atmosphere comfortable for the patient. So if you come to our office, you'll notice there's a lot of earth tones, a lot of greens, neutrals. There's not a lot of loud noise. We try to keep the aroma in the office very neutral. So we do a lot of different aromatherapies like lavender, eucalyptus. Sometimes we'll even offer some noise canceling headphones for patients to use with our iPad, or they can hook up to their phone. Blankets, pillows, sunglasses, just really something to make it feel more like a spa experience rather than you're coming in, it's this cold room where you're like, there's these tooth dust smells and all that stuff. So on the outside, we really do try to make sure the environment is right. And then on the inside, it's communicating, making sure that everybody that you meet is very knowledgeable in what they're explaining, whether it's the dental assistant explaining something to you as far as like your post-op instructions, or the front desk going through your dental benefits with you, explaining the cost to you. Because sometimes the dental anxiety could be cost related, and that's real too. So we try to really get in front of that. So that way we're letting patients know, hey, this is what this is going to look like at our office.
I've never heard a dentist and a spa used in the same sentence. So you really are talking about building something brand new from the ground up. I love it. And you mentioned a cost a second ago, Dr. Karassi. Dental insurance can be a real bear. Some folks may have great health insurance, but not great dental insurance, or may not have dental insurance, or may not know what their dental insurance is. How do you work with folks who don't have insurance?
So we have a couple of different options for patients. Sometimes we have patients that are just trying to get to know us. They're, like you said, maybe they're anxious and they're not quite ready. We have a special package for patients that want to see us one time. Maybe they're in town and they're going to be moving. So there is a package for patients for a one-time offer to get their teeth cleaned, an x-ray and exam, and that's that $99. If you live in Royal Oak, you may have gotten our postcard, so that's a special on the postcard, and it'll be a special through the podcast. So you have to mention the podcast. And then we have a membership plan. So this is something that I'm really excited about. Under $30 a month, you get your 3 hygiene cleanings instead of 2. So most people's insurance only covers 2. I'm a firm believer in 3. Believe it or not, the reason most people get their teeth cleaned twice a year, it's because that's what insurance covers. It's not because that's what the dentist or the hygienist recommends.
Okay.
So we offer 2 exams, your full set of x-rays, 3 hygiene appointments, and then 15% off any prescribed treatment. It's called the Well Family Plan. I've actually had some patients who were purchasing their insurance, their dental insurance on their own, opt out of dental insurance because this was more affordable for them long term.
Oh, wow. Okay. That is really interesting. And you mentioned a moment ago about you're doing yourself a disservice if you don't go to the dentist regularly and for whether cleanings and exams and everything else. I know as science and medicine evolve, we're kind of looking at the body holistically. Everything in the system is tied together. Can you explain airway dentistry and what that involves?
That is one of my biggest passions. Airway dentistry, believe it or not, has been around for quite some time, but it's gaining a little bit more traction right now. With the older generation, the silent killer was heart disease.
Yeah.
Our generation, it is sleep apnea.
Oh, wow.
It's something that is incredibly underdiagnosed. It's something that a lot of patients thought was normal. Oh, I just fall asleep on the couch and I snore. We're starting to see that your airway is so deeply connected to all of the different functions that your body does. Healing, growing, repair, your gut, even your oral microbiome, all those bacteria in your mouth. When you're sleeping with your mouth open, it's disrupting all of that moisture that is supposed to be there to help rinse that bacteria throughout the night. So alongside it being extremely detrimental to all of our systems, it's also very, very detrimental to our dental health. So at Wellness Family Dentistry, we treat obstructive sleep apnea using a mandibular advancement device. So these devices are an alternative to CPAPs. They are FDA approved. So it's a really, really great option for patients that can't wear a CPAP. Believe it or not, the compliance on a CPAP is under 50%.
I do believe that, knowing people who have them and what a pain it is if they're traveling or just forgetting, I'm too tired, I'm just going to go to sleep, I'm not going to bother to hook up to it. Yeah.
Absolutely. So the alternative of it being compact, easy to use, and then you see your dentist every 6 months. So if you're seeing your dentist who's also managing this appliance for you, it's dynamic. If there's anything changing, we can adjust. We're doing sleep studies so that we can ensure that that appliance is still fitting properly and is still functioning properly. I had a patient one time a few years ago. She was unsure. We do a workup for every patient. And she was like, I don't think I have sleep apnea. My husband always says that sometimes I snore. And I said, based off of the measurements I'm seeing, based off of these assessments that I'm making, I think it's best that we do a sleep study for you.
And is that something you send out to do or you do in-house or?
This is something that we can opt to do in-house, but when it's done in-house, we don't have dental benefits to cover it. So sometimes for some patients, we do recommend that they utilize their medical and go through their physician.
Sure.
And she did the sleep study and she came back with moderate sleep apnea and we made her an appliance and I was seeing her throughout the following months and she said, Dr. Karassi, I don't remember the last time I dreamt. Because she was in such light sleep for so many years that she was never even reaching REM sleep where she would dream and, all of the things that happen when you rest or what
including
we think of
all that
sleeping.
Restoration in the REM cycle. Yeah,
exactly. And she was like, I can't remember the last time I was dreaming and I feel like my life has changed. So she still has a cup of coffee. We all do. But she was having 2 cups of coffee in the morning. She was having to take Benadryl at night before she goes to bed. And we were able to eliminate all of that through just a proper conversation. And that ties back to that thorough visit when you first come in of, hey, you've been clenching your teeth. Oh, I've had TMJ my whole life. Well, now we're seeing that a lot of patients that have TMJ issues or jaw issues, clenching and grinding, is very closely directed to an improper breathing or improper airway. So what happens with obstructive sleep apnea is your tongue is blocking your breathing when you're laid back.
Okay.
So you're not getting enough oxygen. A telltale sign is you're waking up in the middle of the night gasping for air. Yeah. That is usually a buzzword for us that we cannot make you a bite guard. You cannot be wearing just something that snaps onto your teeth because now we're putting more things that are stopping your breathing in your mouth. And that can become really, really dangerous. So thorough diagnosis is very important. A thorough health history is very important, understanding if that's something that has been a trend in your family history. Sometimes with patients that have experienced a sudden weight loss, sudden weight gain, things like that can also affect it.
So this device you're talking about, how does it work in terms of, is it less, I don't want to say obstructive, but less cumbersome than a CPAP? How does it work if you're using one of these devices?
So first and foremost, it doesn't plug into the wall. So that's definitely one of the biggest perks of this device is you don't have to be hooked up to a machine. The way that the device works is very strategically and in 0.5 millimeter increments, we are manipulating the bottom jaw to open up your airway when you're in that laid back position. So essentially what we're doing is we're allowing for more space for your tongue. So it's non-surgical, non-invasive, and it's an appliance that you can take in and out. We typically will make 2 appliances. So you'll wear another one in the morning to put your jaw back into the correct position so that you don't lose that bite.
Fascinating. I feel like I have learned a lot in the last.
I'm glad. That's my goal is for education.
I was very fortunate. I'm 45 years old. Knock wood. I've never had a cavity that I've known of. My folks took me to the dentist a lot when I was a kid, so I was seeing a dentist regularly and have every 6 months my whole life. So I've taken good care there. Do you have any tips for parents listening in terms of getting their kids started with dental care?
Yeah, absolutely. This is one of my favorite topics to talk to people about is pediatric dental care. It's something that I tend to see, what I've seen in my career is people are split. Either you were the type of person that went to the dentist with your parents took you every 6 months, you got pretty good understanding of how many teeth you have. And then we have patients that maybe were less fortunate or it just wasn't as important in their lifestyle. And they're just unaware. Maybe the first time they went to the dentist was that when they were in their 30s and now they have young children and they're thinking, okay, these teeth are kids' teeth. They don't really affect their adult teeth. I have a couple of tips for parents. Start the children young. Yeah. The younger the kid is when they come into the dentist's office, the more comfortable they're going to be with understanding that this is part of their health care. A lot of times what happens is as we're getting older, we're aging, we become more and more busy. And if something is not seen as a priority in our health or in our life, we're going to ignore it. So starting children very, very young, as soon as kids have teeth, that's when they need to start seeing a dentist. Whether it's a pediatric dentist or a general dentist that sees children, getting them in early. Typically what we'll do if a child is under the age of 3, we're not really doing anything too crazy. It's more getting them comfortable, understanding hygiene. Typically what I'll do is I'll go over with parents the eruption sequence of teeth. How are they going to get teeth? A lot of parents don't realize that kids' adult teeth come in before they start losing baby teeth. They start getting adult molars before they've lost any teeth. A lot of times parents will come in, the kid's, 5 years old, and they're like, oh, they haven't lost any teeth yet. And I'm like, okay, but there's some adult molars back there. So we need to start working on that hygiene and getting patients comfortable with understanding how to properly brush, what types of products to be using, how often to be brushing, what to do when patients have sensory issues. All these things are the types of topics that we cover when a patient comes in and they're very young. In my experience as a general practice dentist, the kids that I have seen under 1 year old, by the time they're 7, 8 years old, I've never seen a cavity on them.
Yeah.
Correlation does not mean causation, but it's still important to note that when they are regularly in the dentist's chair, there is an understanding, whatever that may be, that there is oral health here that needs to be addressed.
For sure. You are so passionate about this topic. How did you become so passionate about it, Dr. Karassi?
Thank you. I really appreciate that. To be honest with you, John, if you talk to anybody I know, they'll tell you I'm passionate about a lot of things. And to be honest, I did not see myself in dentistry when I was a kid. I always thought I would be an artist of some sort. So I actually joke around sometimes if you ever meet me outside of the office that I'm a potter and then I do dentistry as well. But when I was, going through my undergrad and my high school, I actually took some time off between high school and going to college because I wanted to really discover what it was that I wanted to do.
Did you do the gap year or more than a year?
I took 2 years. A
gap 2 years. I love it.
Gap
okay.
2 years. Yeah. And kind of like you, I'm very inquisitive. So I would talk to people all the time. I would ask what their profession was and if they could go back, if they would do it again. And at the time I was taking my siblings to their dentist. And of course I asked everybody, struck up a conversation with everybody I could. And I said, if you could go back, would you do it again? And he said, yes, no hesitation, which made me think, okay, this is the first time somebody has said this. So I started meeting a lot more dentists. He got me in touch with a lot of his friends, a couple of specialists. And before we knew it, I was full in. I wanted to become a dentist, and I love the lifestyle. I love the ability to meet new people, be integrated into the community, really be a part of the healthcare system in a way that is very unique. And dentistry has so many different pieces to it. There is the health portion, there is the total body wellness portion, which is really where we stand. And then there's the aesthetic portion that kind of is one of those that's the most apparent to patients, which we also love to do here at Wellness Family Dentistry, things like Invisalign, cosmetic veneers, things like that. So we try to do it all, which is really what drew me to the profession, the ability to offer so much in such a unique space.
And are you a new member to the Royal Oak Chamber?
I am. This is my first year. So we joined as the practice opened.
Awesome. Have you had experience with events or the staff so far?
I have. Actually, Christina has been amazing. She's been one of the people at the chamber that has been so helpful in onboarding me. She's so kind, helped me use the space at the chamber when I was interviewing employees before our space was even open. So
awesome.
I definitely used more than one of your Keurig pods in there.
Well, we're thrilled to have you. You're certainly a great addition to our group.
Thank you so much, John.
Before I let you go, we do ask a Fishbowl question of the day. We pull a totally random question for you. So
I love that.
Let me pull one out here. What is one food that you will not share with people around you when you're eating it?
This one is awful. I love the yellow Laffy Taffies.
Oh my gosh, you've lost your license.
That is, I will only eat it if I know I have a dental hygiene appointment coming up, because it's just, isn't that funny how that's like the anti-dentist and that's my favorite thing. So I do not share those. Very lucky for me, though, very few people even care for those. So
yes, the banana one, right?
The banana one.
Yeah.
Yep, that's the one.
Oh, it's funny. And what I love about, people, you get these stereotypes of people in professions and stuff. I have a client who is a dietitian nutritionist, and I met her for dinner. And I was like, oh, shoot, what do I order? I'm here having dinner with a dietitian nutritionist. She's like, are you kidding? Get what you want. And I was like,
get what you want.
The human element is not lost here. That's good. That's good.
Yeah, it's funny how that is. We always joke that the most snacks are in the back of the dental office because we're the biggest snackers, but we brush between every snack.
I feel like I could ask you about Halloween, but that'd be a whole other podcast. So,
oh my gosh, you don't even want to know.
If somebody listening wants to get in touch with you at Wellness Family Dentistry, Dr. Karassi, how do they best find you?
The easiest way to get a hold of us is by utilizing links on our website. So our website is wellnessfamilydentistry.co, not .com, .co, wellnessfamilydentistry.co. You can always call us or text our phone number at 248-744-4066. The website is a great spot to get information about the services that we offer. You can book appointments online, and you can always send us an email through there as well.
You do have a really great website and a lot of good information on there. I was looking at that before we hopped on here. So
thank you so much, John. I appreciate that.
This has really been a fascinating conversation. I really enjoyed getting to know you, and welcome to the chamber. Thank you so much for being here today.
Thank you so much, John. Thank you for your time, your thoughtful questions, and this really delightful interview on this Friday night that's nice and snowy.
There we go. Well, for my co-host, Lisa B., who couldn't be here, she's with Century 21 Northland. You can find her online at soldbylisab.com. And I am John Gay from Jag Podcast Productions. If you have any questions about a podcast, audio, or video, starting or improving your existing show, you can find me online at jagpodcastproductions.com. We want to thank you for checking out this episode of The Rock Pod. It's produced for the Royal Oak, Michigan Chamber of Commerce. For more information on the chamber or chamber events, you can go online to royaloakchamber.com.